Hello, everyone. Welcome to part 2 of Herbal Basics, Teas, Tinctures, and Tablets, which is also the second presentation in what will be many presentations in my Herbal Basics series. So we've already covered galenical liquids, extracts, and tinctures in part 1 when we consider herbal dosage forms. Now in this part 2 presentation, I would like to examine hot water extracts, which can be infusions or decoctions, and they can be incorrectly described as teas. And then move on to talk about solid dosage forms, which of course tend to be the modern preference among patients. But of course, we know that galenical liquids and hot water extracts still have an incredibly valuable role to play. And the solid forms are capsules, tablets, powders, and pills. Pills are less desirable because they represent old technology and they don't often dissolve very well in the body. But capsules, powders, and certainly tablets made with good technology so they disintegrate rapidly are very effective herbal dosage forms. So let's begin by looking at hot water preparations. As mentioned, they're incorrectly called teas. So what's the difference? Well, they're infusions or decoctions, and they're made in a specific way, as opposed to a herbal tea taken for pleasure, which is sometimes called a tisane, that can be made in many variable ways. You can steep for a minute, you can steep for 10 minutes, you can put in a lot of herb, you can put in a little amount of herb, and so on. So tisanes still do have therapeutic effects. I'm not ruling that out, but it's infusions and decoctions are what you do when you really want to apply, in a sense, a medicinal effect. So how do we make herbal infusions? Well, when I was a student in Tunbridge Wells way back in the early 1980s, I was taught it was an ounce to a pint. So an ounce of the dried herb, usually, to a pint of recently boiled water. Now we're metric, so that translates to 30 grams per 600 ml, but you don't necessarily want to make that much, so you can use ratios of that. So about 10 grams per cup. Now for a dried herb, that can be a considerable bulk. So you add the recently boiled water to the dried herb or herbs in a closed vessel, as you can see in the image. You steep generally for 10 to 15 minutes, at least 10. You strain and you drink 1 cup, and if you've made 600 ml worth, you reserve the rest and drink it once or twice again during the day. So that's a classical herbal infusion. Now, in terms of a herbal decoction, these are usually used for roots and barks and what have you, for which just steeping them in water is not really going to penetrate into the plant tissue. So you're not necessarily going to draw much activity out of it. So for decoctions, what we need to do is a sustained simmering in hot water to get that activity to transfer into the water. So again, it's 30 grams to 600 ml or fractions thereof. You add water to the dried herbs in an open, or it can be a covered vessel if you're concerned about volatiles, and you bring to the boil. And you simmer for 10 to 15 minutes. And you strain and drink 1 cup. And if you've made 600 ml, like with an infusion, the rest is put aside for the day and drunk on the day at a later stage. Now, in, say, for example, traditional Chinese medicine, they might have a formula that has herbs that are more suited to infusion and herbs that are more suited to decoction. So the way they manage that is that you put the decocted herbs in first and do the decoction, And then at the end of the decoction, you add the herbs that are suitable for infusion, mix them in and cover it, and then steep for 10 to 15 minutes before you strain and drink. So you can combine infusion and decoction together for a herbal mixture, depending on what herbs are in there. So what are the advantages of hot water preparations? Well, they involve the patient in their treatment. You know, they have to go and actively make their medicine. And that can be a good thing and an empowering thing. And they're often a valuable adjunct to other dosage forms. I was taught they're particularly good for skin disorders and for urinary tract problems. And that's certainly been my experience. And of course, if you're giving diaphoretic herbs, which to my experience really only work to that optimum peak if they're given hot, then of course you have to make an infusion of your diaphoretic herbs. They can be a valuable adjunct to other dosage forms. So you can give extracts or solid doses or, as the core therapy and say, and also drink this tea. And I do it often. Case in point, someone has anxiety, I might prescribe a formulation of valerian and passionflower and ziziphus for them in solid dosage form, or I might make a similar kind of formulation in liquid form for them. And then I'll go and recommend that they also drink chamomile tea a few times a day, but making it like an infusion. So in other words, they cover it and they steep for at least 10 minutes. And the advantage of that chamomile tea is the water extract of chamomile has been clinically proven to lower anxiety in a very sophisticated clinical trial, which did use the chamomile tea for 6 months and hence has greater validity for that reason, because for general anxiety disorder, you need to generally do the trials for 6 months. Disadvantage for some herbs, water is a poor solvent for some herbs. And particularly if we look at echinacea and the alkylamides, the tingly components of echinacea, they are not well extracted by water. They're too non-polar. So water is a polar solvent. So anything that's non-polar, it's not going to be extracted very well by water. But in many, many cases, especially when it's hot, and especially via decoction, you'd be amazed what the water gets out. And in traditional Chinese medicine, they often put licorice in their decoctions, and the licorice contains saponins, especially glycyrrhizin, and that acts kind of like a detergent. And as you know, detergents can get non-polar things like grease out of your clothes, and similarly, they can help extract the non-polar ingredients from the herb just using water. So that's a little trick that was recognized ages ago in traditional Chinese medicine by using the saponins for their detergent property, and especially licorice. If we look at an example, some patients say, I'm growing echinacea and I'm digging out the root and I'm making a tea out of the root. And I say, don't waste your time, because those alkylamides just aren't going to work that way. You have a relatively short extraction time, so you're certainly not getting the kind of efficient extraction you would get with maceration or percolation. They're hot, so they can only be consumed slowly, and even if you wait for them to cool, there's still a fair volume of liquids, so the person gets to well and truly taste the herbs as a prolonged experience. And if the herbs are not that wonderful tasting, that can impact compliance. And of course, if you're applying heat in a process, then some of the delicate active components of herbs can either be lost because they evaporate off or broken down by the heat. So now for the final part of this brief presentation, I'd like to talk about solid doses. So as mentioned, they can be tablets, capsules, pills, or powders. Now, what's in them in terms of the herbal active can either be just the dried herb powdered up very, very finely, or an extract of the dried herb. Typically, it also can be an extract of the fresh herb, but typically an extract of the dried herb. So you make a liquid galenical, and then you carefully dry that down to a residue, and often you'll need to put it on a bit of a carrier so it's manipulable. You can manipulate it and put that into your capsule or your tablet, or even your powder. So either the straight dried herb or a liquid extract dried to a solid or a semi-solid sometimes, that's then put into the capsule or tablet mix and then rendered into a solid. So what are the advantages of solid dosage? Well, they certainly do help with compliance for most people. And they're very convenient, especially when you're traveling. And there's no alcohol in them if that's an issue for the patient. What's their disadvantages? Well, they're fixed formulation. So often they're a single herb, but there also can be many herbs mixed together. And that means if you want to get an effect with a fixed formulation, you might be applying some herbs that you think may not be necessary. If you've got just all the single herbs in solid dose, well, you can tailor it more that way, but then many doses need to be taken, because for each herb, you'll have to have a tablet or a capsule, whereas it's in a liquid, they're all mixed together and it's just one go. You have decreased flexibility of dosing. You know, for a liquid, you can give 1 drop or you can give 20 ml, huge range. But with solid dosage forms, there's far less flexibility. You can break tablets, you can open up capsules and take a portion of them, you can crush tablets and take a portion of them. There's more flexibility, of course, with powders. And because of their form, because children can't necessarily swallow tablets, they can be unsuitable. And some adults have difficulty with tablets. I have some elderly patients who do have difficulties in that regard. But for that, you can crush the tablet. You can recommend they crush the tablet and then mix it with a bit of water or honey or juice or something like that. And that works quite well for children. So I actually prefer to give solid doses to children, but either emptied out from the capsule or crushed if they're tablets, and then mix them into a suitable base for the children to take. I think that's preferable than using glycerol-based extracts, because glycerol's like water. It's not necessarily a good solvent for many of the non-polar components that are found in herbs. So as I mentioned, solid doses can be made straight from the dried herb, finely powdered, or they can be made from an extract of a liquid that's dried. So what are the relative advantages and disadvantages of these two approaches? Well, if you're looking at an extract made straight from the dried herb, like, for example, a slippery elm capsule, which I take personally and which I use in my practice a lot, there's minimal processing. But the disadvantages are that if it's just a straight dried herb, it might not comply with microbial standards. And even worse, it might have microbes in there that are not beneficial to the patient. And because it's not being concentrated, your dosage is limited. So you can generally only get 400 milligrams at best of a dried herb into a large capsule. So if you want to give 3 grams, for example, you've got to give 7 or 8 of said capsules. And again, you're using large capsules or large tablets, so the dosage units can be bulky. And the final point, and this is a critical one, is you're not extracting first. So you're relying on the patient's digestion to extract the actives out of the dried herb that's been put into the tablet or capsule, or given as a powder. And for that, patients do need good digestion to get the greatest benefit. So if we look at solid doses made from dried extracts, what are their advantages and disadvantages? Well, one advantage is they're compact and they can be quite potent dosage forms. So, in the example of ginkgo biloba, often you're using a 50-to-1 standardized extract. So it means you just put 60 milligrams in a tablet, and it's a small tablet, yet it's got the equivalent of 3 grams of starting dried herb. Now, if that's mystifying you, what I just said then, don't worry, because in my next presentation in this series, I'll go into how you work out doses across the various dosage forms. And the second advantage is that because they're made using often alcohol and water in the initial extraction, there are no microbial issues because the alcohol kills the microbes. And because you're using an extract and you can adjust its strength and potency, you can readily achieve consistent quality from batch to batch. The disadvantage is there are potential losses during processing, especially when you make the liquid extract and then dry it to put it into the solid dosage form. That's where the losses can occur. And the other one, the final point, is a really big one, and that is that companies buy in extracts. So you can have companies that are rather unsophisticated in their herbal knowledge, and they'll just buy in an extract from a supplier and take it as read, just believe what the bit of paper the supplier gives with them about what this extract is and its quality and the fact that it's actually made from that herb in question exclusively. And unfortunately, that's not the case. And it's not the case perhaps more than we realize, because if you look at the American Botanical Council, they've brought out a botanical adulterants bulletin, and there's now more than 80 of them talking about how herbs, but especially these bought-in dried extracts, can be adulterated and don't reflect the true purity and potency of the herb in question. So thank you for listening to this brief presentation, and next month we'll do part 3 of teas, tinctures, and tablets.